Today, we're talking about retinol. Exactly how strong can you go? Hello TLCers. Today I'm talking about retinol. Well, vitamin A to be exact. Because as you know, there are many different types of vitamin A that you can have in your skincare. I'm not talking about isotretinoin, that's the oral version, Roaccutane, the medication that sometimes people take for acne. I'm referring to vitamin A compounds such as retinol, retinol palmitate, retinoic acid that you can have in your skincare. So just as a disclaimer, I am talking about some medicines here. So any of the medicines that I discuss, you must use after a consultation with a healthcare professional. So it's not really something that you can just go ahead and use on your own because they're pretty strong. So most of the skincare that we get from a cosmeceutical range, for example, there will be a product in there that will contain some retinol. And retinol's got many different formulations to it. So one of the least strong, if you like, is retinol palmitate, which needs to be converted to retinol and then retinoic acid in the skin. And if you're quite a sensitive skinned person, that might be something wise to start off with. But that's not really what we're talking about today, because I want to talk today about strong retinols and retinoic acid and how to use those. So if you look at a product, like for example, Zio Obagi have a 1% retinol in their range. I try and get patients who have got a medium to thicker skin type, like myself, all using a retinol. And that's one of the ones that I do use quite a lot of. Either the Zio Obagi one or Obagi Medical have got a 1% as well. And there are multiple reasons for that. So first of all, if you've got any signs of aging, retinol will help to combat that. Second of all, it's good if you have acne. So you can have acne and be a little bit older. Some of us are in that unfortunate position where we're getting the first signs of aging, but also having some active acne as well. And retinol is really perfect for people who are in that sort of crossfire zone. The reason retinol is so good is because it's one of the few ingredients which has been shown time and time again to have a beneficial impact on the quality and texture of your skin. So there are literally hundreds of different papers published about this. And the way that it works is it stops you from breaking down your own collagen in your skin. So there are some enzymes in your skin, matrix metalloproteinases, MMPs, which break down collagen. Retinol will inhibit that from happening. It also increases the rate of cellular turnover. So the cells that are at the bottom of the skin layer, they'll come to the top more quickly. It helps to regulate pigment problems. So if you have hyperpigmentation, either from sun damage or melasma, then retinol will definitely help with that. It's good if you have acne because it helps to not exfoliate in the way that we think of an exfoliator. So it doesn't chemically exfoliate the skin surface, but what it will do is stop the pore from becoming clogged because of the rapidity of the cellular turnover. So pretty much everybody, I think, who can use a retinol should use a retinol. Let's talk about strength. Retinol comes in different percentages. So the ones that you will most commonly see will be 0.3%, SkinCeuticals do a 0.3%, and Medicate, 0.5% and 1%. They'll be the most common things that you'll see. Sometimes you will get the occasional brand that, such as The Ordinary, that will do maybe a 2%, but that's much less common. I do think that even using a 1% retinol is definitely worth it. Even a 0.5% retinol is worth it. If you've got very sensitive skin, you may not be able to just go straight ahead and use those. You may need to start with a 0.3 and work your way up to using a 1%. Myself, I use a 1%. At the moment, I'm using one by Illumier, but I have used many, many different brands in the past. I'm just on Illumier at the moment. What does it smell like? Well, I have heard it said that retinol smells like cake. I think that might be true, actually. It does have sort of a cakey aroma to it. It's not unpleasant. How do I use it? Well, cleanse. If I've been wearing makeup, which is unusual for me, but for example, after I've been filming for you lovely people, I will have been, so then I'll tone, and then I just apply the retinol all over the face. They do say you're supposed to apply it from here to here. I myself don't really wear low cut tops or anything like that very often, so I maybe only go down to here once or twice a week. But if you're somebody who does expose this area a bit more frequently, then why not? Just do the whole thing. Why not? Speaking specifically now about stronger types of retinol, I'm sure you're aware that there are some items which are only available on prescription, which you must get after a consultation with your healthcare professional. So you can get tretinoin, which comes either as a 0.0025%, so it's got extra zeros in it over and above the regular retinol. Tretinoin contains more zeros because it's stronger. And you can get 0.05% tretinoin, and then you can get 0.1% tretinoin, which is the strongest one that you can get. Why would you use these different formulations of tretinoin, and how do you use them? Well, if you're somebody who has got really, really bad melasma, or you want to see a result really, really quickly, you will use the strongest. You'll use 0.1%, and you'll go heavy and hard with that. And by that, what I mean is you'll use an amount approximately the length of your little fingertip all over the face every single night. Yes, it's going to be horrific. You will peel and your skin will become dry and cracked, and you will hate using it. I've done this myself before. So I was using the Obagi Nuderm system. I've done it 3 times now. And with that, I was coupling it with the 0.1% tretinoin. Let me tell you, it's not easy. It's really not easy. So for the first 3 days, you think nothing is happening. And then maybe after around day 4 or 5, boom, cracked skin here, next to the nose as well, right here. And it's very uncomfortable to put on. So it feels, your skin feels really itchy and you can't wear makeup on top of it. So forget wearing makeup. Actually, that's why I don't wear makeup anymore. That actually broke me of wearing makeup. Because if your skin is really, really dry and irritated and then you put makeup on top of it, it just feels even worse. So I just quit wearing it. So you're in this dry, cracked, not very happy period for around, not too long, maybe 6 weeks, maybe 6 weeks or so. It depends. Different people respond slightly differently. For myself, I was like that for 2 months. But it does get a lot easier. So the first 2 weeks were the worst. And then I'd say towards the first month, it didn't really bother me so much. So, you know, you get up in the morning, you wash your face, you apply your products, and then maybe by 3-4 p.m. During the day, you'll start to notice that around the mouth, the skin there is just starting to lift a little bit, and you can see where it's sort of coming away. So at that point, if you want to just, you know, go and wet your face to wet the skin, you can just remove it like that. What's really important if you are experiencing peeling using tretinoin is that you don't just take a hold of the skin and rip it off, because if you do that, you'll end up with not only a big red patch there, because you don't have any epithelium on top of your skin, you're also at risk of getting hyperpigmentation. So I had an unfortunate experience when I did do that. Yeah, I pulled a bit here, and it took about a week for the redness to go away, which is not ideal. Also worth mentioning is if you are doing some sort of hair removal and you're using any sort of vitamin A, just be really careful, because I've had waxing done before on my eyebrow, and it will take the skin off with it. So you really have to get into threading if you're using either a retinol or tretinoin. Otherwise, honestly, I could show you some pictures. I had it done once, and the lady who was doing my upper lip, I think she got distracted. I did say thread it, don't wax it, and then suddenly I felt this hot wax on my upper lip. I thought, oh my God, this is not going to go well. And I was right, it did not go well. I had a massive scabby area here for a good week after that. So yeah, just bear that in mind. So 0.1% tretinoin if you've got huge issues. I tend to start most of my patients on a 0.05% tretinoin if they need it. I'd say that was the most common thing that I use, because it will still give you a good improvement of the pigmentation, and not many people really need to use 0.1%. I just used it because I thought, you know, why not? Let's see how good my skin can get. And then the 0.025% tretinoin, it actually doesn't penetrate that deeply at all. So I don't use that one so often. You can also use these products, by the way, on the body. So if you get keratosis pilaris, you know, with the little bumps on your arm, the chicken skin thing, you can use it there. You can use the tretinoin also on the chest as well, anywhere really. But I have a trick for you. So if you don't want to use tretinoin because you don't want the downtime of using it, you could instead, there's a drug called adapalene, which is a 3rd generation vitamin A compound, which is much less irritating. It gives you a very similar sort of results in terms of regeneration and non-comedogenic effect, but it takes longer to get to that point. So with tretinoin, you see the results quite quickly. I would say within 1 or 2 skin cycles, you really notice a difference. With the adapalene, it takes a little bit longer. So we're talking, you know, maybe 2 or 3 skin cycles to see an improvement there. But you don't get any of the dryness or the cracking or pretty much any of the downside that you will see with tretinoin. You just don't get that with adapalene. So that's quite a popular thing to use. Sometimes people ask, can I use a moisturizer at night when I'm using one of the stronger vitamin A's, like the 1% retinol or any form of tretinoin or the adapalene? Well, you won't need to use a moisturizer with the adapalene. It comes in a cream. So by the way, cream formulations are much better than gel formulations, I find, for most people. So you can get the tretinoin either as a gel or a cream. I would definitely suggest that even if you have acne, to get the cream, because I find the gel is just way too drying, and it makes people very uncomfortable. But definitely don't put on any additional moisturizer when you're using tretinoin. You just want to cleanse, tone, apply your tretinoin, and then leave it. Sometimes people will step up their use of vitamin A, so instead of using it every night, they'll use it maybe 2 or 3 times a week, and then 3 or 4 times a week, and then so on and so on and so on. For me, when I'm going through my cycles of using something a bit stronger, I tend to just go for it. I'm like, whatever, I know I'm going to get this peeling, I know I'm going to get irritation, redness. Just seriously, I just every night put it on, and I know that I'm going to get through it. So it depends on, I guess, what your job is, because if a lot of people are going into work and maybe they're experiencing some peeling, might be a bit awkward to explain to your co-workers, whereas in the clinic, if my face is hanging off, then it really doesn't make that much difference. You know, my patients will just be like, I see you've been doing a treatment there. I'm like, yes, I have. Yes. Yeah. Thank you for noticing. It will look good soon. Don't worry about that. Just before I wrap up, I just wanted to mention a couple of other things. So the first thing is, don't use any vitamin A compounds during pregnancy. That's an absolute no-no, because vitamin A is important in making the baby, and you don't want to mess up that cycle. If you're using any kind of vitamin A, you need to use a sunscreen with it, because it makes your skin sensitive. It's just bad. Just use a sunscreen, okay? Don't use vitamin A during the day. That's a nighttime thing. Irritation is going to happen. It depends on your skin barrier function, whether or not it's healthy, as to whether or not you can just jump straight in and use one of the stronger products. If you can't, if you know that you've got sensitive skin, please don't just buy a 1% retinol and use it thinking, oh, it's going to be fine. It won't be fine. Just step up if you're very, very sensitive. But equally, expect there to be some irritation. Expect there to be a little bit of flaking. That's normal. So don't just check it out just because you can see that the skin's looking a little bit red. You just got to power through that and it'll be fine. If you're interested in trying any of the other, or you need to try any of the other stronger vitamin A compounds, please don't just buy them on the internet. Have a proper consultation with a dermatologist or with your doctor, and they'll be able to guide you through which would be the best product for you. Because if you buy them just directly from the internet, you don't know if it's fake, which either means that it's not going to work, or maybe it could even be too strong and it could have other weird stuff in it that you don't know about. So yeah, bad, that's bad. Make sure that you're going to a proper pharmacy. Okay, so that's all we've got time for this week. If you've ever used any form of vitamin A, whether it's tretinoin, adapalene, retinol palmitate, whatever, and you've got something that you'd like to share, please just pop it in the comment section below. And hopefully we'll see you next week. Don't forget to like, comment and subscribe.